and thank you so much for joining today's webinar. We did have a little bit of a technical difficulty, so thanks for your patience. I pride myself on starting on time, and we're a minute late. With that being said, just a couple of things. I actually have to stop my get out of my screen for a moment, so bear with me. We are going to get started in just a moment. In the meantime, couple of things worth mentioning, I think. For those of you that are not familiar with NeedyMeds, I certainly will go over who we are and what we do in the beginning of today's presentation. But the rest of the presentation will focus on the important subject of how your social network can help improve your health. Bear with me a moment. I'm pulling up today's PowerPoint presentation. And in the meantime, I will ask our guest, Andrea, to give us a shout out to make sure that we can hear you clearly as well.
Hi, thank you, Carla. This is Andrea Baer. Can you hear me okay?
I can, and I am just pulling up our PowerPoint presentations. So bear with me, everybody, and then we are going to take it away as soon as possible. Bear with me. While I am pulling this up, just bear with me, everybody. I would be happy to share my screen with you. So let's get started with that and talk a little bit about today's presentation, which is, as you can see by the first slide of my PowerPoint, today's topic is Connected for Success, how your social network can help improve your health. Now, as I had mentioned, one of the things I like to do in the beginning of webinars is just let people know a little bit about NeedyMeds. For those of you that are not familiar with us, NeedyMeds is a national nonprofit, and there's our mission statement that we actually updated in 2016 to more accurately reflect what we do, which is that NeedyMeds is dedicated to educating and empowering those seeking affordable health care. And how we do that is by connecting people to programs for free and anonymously through our website and toll-free helpline. And of course, I will provide the information for NeedyMeds at the end of today's presentation. A couple of things I do want to mention, and in the meantime, as I'm going over some what I call housekeeping tips, I'm just going to put up a slide that shows the NeedyMeds homepage. And I always like to put that up because really our website is the face of our organization. But I also like to put that up because, as I had just mentioned, our goal is to connect people to programs that will help them afford their health care. And I said I do that through our website and toll-free helpline. That's what our website looks like. And where all of the cost savings programs are, they're under the Patient Savings tab on the top left-hand side, and you can find our toll-free helpline in the top right corner, 1-800-503-6897. So while that's up, here's a couple of housekeeping tips. If you do have any questions, you can feel free to type them in at any time throughout the webinar. Just know that we will reserve answering questions until the end. And just bear with me. Is everybody seeing my screen? I apologize for that if you guys weren't seeing my screen up until that time. So, and you didn't miss anything. You missed the first slide of my PowerPoint presentation, the blurb about what NeedyMeds is, and now I'm putting up that screenshot of the homepage, and the Patient Savings tab that I was talking about is in the top left-hand side of the navigation bar, and that 1-800 number is at the top right-hand corner. And thanks to the audience for their patience with the technical difficulties we're experiencing this webinar. Anyway, as I was saying, in your GoToWebinar control panel, you should have a section, as many of you used to tell me, you couldn't see my screen, but you can feel free to use that section at any time throughout the webinar if you have any questions for our presenter today. Just a heads up that we will reserve answering questions until the end. Also, heads up, if we don't get the chance to answer your specific question, we will absolutely follow up with you personally via email by tomorrow. But of course, I'll provide you with the contact information at the end as well. Also, the heads up that this webinar is being recorded and will be available for viewing on our YouTube page soon, and you can find the NeedyMeds YouTube page on the top right hand, that red little button that says tiny YouTube. you can click on that, and it'll take you right to the NeedyMeds YouTube page. You can also find both of our PowerPoint presentations in the handout sections of today's webinar. If you have trouble downloading them, you can shoot me an email after, and I'd be happy to send them along to you. So as I had mentioned, NeedyMeds' mission is to educate and empower people seeking affordable health care. And certainly we define the education portion of our mission by educating people about NeedyMeds and the resources we have to offer. But we also define that education portion of our mission by letting people know about other great resources and ways to stay healthy, which is why we are so pleased to have our guest from Mended Hearts here with us today. Mended Hearts is a national and community-based nonprofit organization that has been offering the gift of hope to heart disease patients, their families, and caregivers. Their mission is to inspire hope and improve the quality of life for heart patients and their families through peer-to-peer support. Now, I know a lot of people, you see the name of the organization, Mended Hearts, and you're hearing me talk about heart patients. But what I want to stress is that today's webinar is going to touch on a subject that is important to everyone, not only heart patients, which is how crucial it is to have a supportive social network in your quest to get and stay healthy. To walk you through this important topic is Andrea Baer. Andrea has a Master's of Science in Nonprofit Management and Leadership and is currently the Director of Patient Advocacy for Mended Hearts and Mended Little Hearts. Andrea has been deeply involved in advocacy efforts and working to assure that the patient voice is at the table. Andrea resides in Pittsburgh, Pennsylvania with her husband and 4 children, but she's here with us now. So without further ado, I'm going to pass the mic to Andrea and have her take it away. And Andrea and audience, just bear with me. I'm going to let Andrea kick it off a little bit. It may take a moment for me to switch to her PowerPoint presentation. So Andrea, if you wanted to just get started bringing people up to speed, and then I will pull up your PowerPoint. In the meantime, heads up everybody, you may just not see my screen for a moment. Thanks for your patience. And Andrea, it's all yours.
Thank you so much, Carla, and I really appreciate the opportunity to be here to talk to everyone about something that I feel very passionate about, and that is peer support and social networking to improve your health. You know, my journey started, I like to say pre-Trenton and post-Trenton, and that's my 3rd son. And a little bit of background on me and how I became an expert on this topic. I was a 3rd-time mom, and on St. Patrick's Day in 2009 was my beginning. My unexpected life event came while everyone else was out drinking green beer and pretending to be Irish. I was a 3rd-time mom, blindsided by the news that my son was born with a congenital heart defect, and he would need open heart surgery in order to survive. So I was devastated and alone and afraid, and I had never even heard of this number 1 birth defect. So I had no idea how this could happen to me. So that was a defining moment in my life, because at that point I decided that I didn't want other people and other families to walk this journey alone. And what I found throughout the last 9 years is that social networking is so much more than one person connecting with another person. And I have found that really surrounding yourselves with people who are successful in all kinds of different ways will help you become a better person when you're navigating this healthcare journey. So it's the unexpected things that change our lives, right? I'm sure that we've all been in a situation where our medical journey has changed. Sometimes it's a fast thing, it's an unexpected thing like mine, and sometimes it's more progressive. So what I would like to, as soon as Carla gets the slides up, we're going to go through some information about support and why it makes a difference and how it makes a difference in people's lives. And I'm also going to give you some really concrete examples of what you can do to live a healthier lifestyle just by improving your support network.
Fantastic. And Andrea, I do, not to interrupt you, I do have the screen up. So if everybody can just shoot me a message again in the questions section to let me know that you can see my slide. I did have the slide up, your second slide, Andrea, about the unexpected. And now we've moved on to the third slide, which is support makes a difference. And it looks like everybody's right there with us. So thanks again, everybody. As you can see, Andrea and I are having some difficulty, but we're so thrilled you hung in there with us because you're going to want to listen to the rest of this presentation. It's really quite valuable. Thanks again, Andrea.
Thank you. And yes, it's always fun, right, when the unexpected happens. So we're going through this a little blind, which is fine, and I appreciate your patience. So as I begin my journey, I realized that no one truly understood how I felt. That is, except for those who had been through it. So when we look at how our social network can change lives, we must first define support. And I think support can come in all kinds of ways, but the connection is made from someone who has been there, done that. And support groups bring people together who are facing or have faced the same types of problems. Others who have been through the same journey will understand and have the ability to connect with you in ways that others, even family members, may not be able to do. So support groups bring people together, and you can share advice and experiences from someone who understands and has been in that situation. Next slide, please. So I know what you're thinking, right? I don't want to sit in another room, in a room of people, and just go through group therapy, right? Well, here's the thing. Those group supports are just one way of connecting with others. So while that might be attractive to some people, others want to experience support and build their social network in other ways. Fun things like potluck dinners, lunch dates, bowling, or any other kind of activity that you connect with another person is really considered a social support network. That network might even be just one-on-one conversation with somebody. If you think about that one friend who you love to have lunch with because you can just feel so much better when you leave that lunch. So I'm even on an online support network where we conduct check-ins with each other about self-care. Since we're caregivers, we ask each other things like, have you brushed your teeth and got dressed today? So that sounds pretty silly, right? But those reminders are vital to people, not because you don't know you should be brushing your teeth or getting dressed, but just because it makes a mental note for you on your self-care and remembering to take care of yourself while you're caring for others. Next slide, please. One really simple idea of social network support is having a workout buddy. If you think about going to the gym and working out or eating healthier, it's so much easier when you have an accountability partner, someone who can help keep you on target, hold you accountable. I know for me, it's a whole lot harder getting out of going to the gym when someone's calling me and saying, I'll see you there. Another example to relate to is, as a mom, I know what is right to feed my family, and I know how to eat healthy and make good choices. But at 5:15 on a Wednesday, when I have exactly 30 minutes to prepare to feed my family a 5 dinner before going out the door to my daughter's dance class, the Wendy's drive-through looks really great. So a support network can actually help you find real-life answers, life hacks as we like to call them, how to get a great and healthy meal on the table in 20 minutes, or how to prepare in advance to have that meal ready. Those are the types of things that you find when you surround yourself with people who are also struggling or who have conquered that battle already. Next slide. And above all else, the emotional support that comes from someone else getting it is priceless. The most powerful statement someone can hear in crisis is, "You are not alone." I remember still to this day, 9 years later, the first person to reach out to me and say this. that was another heart mom who found me online and said, you know, my son has a congenital heart defect too. Those words comforted me in a way that no one could ever explain. Next slide. And so the fact is, empowered patients make better healthcare decisions. They make better choices in their lifestyle and in their health. Empowered patients can look for answers and find them. And the process of becoming empowered helps you as an individual find a way to thrive through the adversities that a complex medical need will bring. Simply by building your social network of support, you can improve your emotional health. And as you become more empowered, you will move from the one person that needs support to the person who's giving support within that network. And that actually happens naturally. You'll also find yourself asking questions of your support network that might not have anything to do with the original reason that you got together. So in a caregivers group, you may find yourself talking about other things that are happening and getting support on, even if it's not directly related to giving support to caregiving. Next slide. Another thing that's really exciting and a really important topic to hit here is that support networks actually improve outcomes. Mended Hearts has conducted a survey throughout the country, and the results were as we expected. Patients who are visited by a Mended Hearts visitor feel less stressed and more optimistic. And also in the hospitals that we have visiting programs, there are lower hospital readmission rates. And Mended Hearts has also conducted case studies in areas that we have strong Mended Hearts chapters and found that individuals who are involved in the Mended Hearts program are more likely to adhere to their treatment plans, such as cardiac rehab or medication therapy. They're also more likely to feel empowered and develop an ongoing social network where they give back to the community. Next slide, please. So then giving back is so powerful. My journey is one of the thousands of individuals who rise to the challenges and come out stronger. And I'm sure that you are experiencing the same types of journeys as I am, if it's not the exact same one. So healing your soul through serving others is a choice. It's a choice of giving, and the journey is not always easy. And there are really hard times, personally hard times, and hard times when you're helping and supporting others. You know, for me, the death of children in our network really always hits me because that's a face of reality that it could be my story. But giving back to the others so that others can thrive through their journey is so powerful and so healing. You know, I'm just a regular mom like all of the other people out here with Mended Hearts and Mended Little Hearts who, when faced with insurmountable odds, rose above. And that's a choice I think that we can all make in our daily life. Next slide, please. So just a little bit about Mended Hearts and Mended Little Hearts. We are the oldest and largest peer-to-peer support network in the country. We were founded by a doctor, Dr. Dwight Harkin, who found that his patients were joining each other and talking and how they actually seemed to not be as depressed because they had other people to talk to about the procedures in his waiting room. And so he worked with them to found the first chapter in 1951. And we've grown to over 300 chapters across the country, serving 460 hospitals. And what's really impressive is we visit, and we call them visits. Maybe they're on the telephone, sometimes they're online. We visit over 200,000 patients annually to give them that peer support. Next slide, please. And we have Mended Little Hearts, which is also a program of Mended Hearts. It was founded in 2004 by Tita Hutchins, who found that parents of children with congenital heart disease needed that same type of support, and they really needed their own network to be able to connect. And so we do a lot of the inpatient family support, and we also do support through our Bravery Bag programs and education and awareness programs that we have throughout the country. Next slide, please. And so this slide just gives you a little bit of information on how to connect with us. As you can see, I won't read through this all, but as you can see, you can find your support network either online, you can find your support in person, on Facebook, Twitter, Instagram, all of those social media markets that are out there. There is support for, I'm sure, every different type of disease diagnosis or any type of journey that you're looking for. And I really encourage you to connect with others that are walking through the same journey as you are. And the next slide, I think that we are ready for questions.
We are. Thank you so much, Andrea, for that very thorough and inspiring presentation on not only Mended Hearts and how they began and how Mended Little Hearts began, but really driving home what I had said in the beginning with today's presentation introduction, which is that although Mended Hearts and Mended Little Hearts focuses on heart patients, their families, and their caregivers, the reality of it is everything that you're talking about is true for everybody, regardless of where you are on the health spectrum, regardless of whether or not you are living with chronic heart disease or another illness. Social networking is crucial. And I was really mostly inspired by that Mended Hearts did a survey to see what the actual impact outcomes are. I already see some questions coming in, so I'm happy to see that. In the meantime, just bear with me, everybody, because what I'm going to do is I'm actually going to go ahead and just talk to you a little bit about NeedyMeds as those questions come in for Andrea, because we hope that NeedyMeds can be a support for you as well. So just a reminder that NeedyMeds, we are a national nonprofit, and we do, as I had said, pride ourselves on educating and empowering those seeking affordable health care, and we do that by connecting people free and anonymously to programs that will help them save or afford their health care, save on or afford their health care expenses. Certainly, another step in staying healthy is the ability to simply afford the medication or other healthcare expenses you need. So we do hope that you can rely on NeedyMeds as an additional source of support for you. I'm not going to go over the slide that you're looking at right now, but that is just a snapshot of our most popular and effective healthcare cost savings programs. While the questions come in, I'm going to go ahead and put up the contact information for both Mended Hearts, Andrea, and NeedyMeds, and a reminder that copies of these presentations are in the handout section of your GoToWebinar control panel. So we actually do, Andrea, have a bunch of questions coming in, and I thought the first one specifically about Mended Hearts and how the organization is a great one, which is what are the roles of the national Mended Hearts as opposed to the local chapters in providing support in the communities?
That's a great question, and I think that the answer is twofold. First, we work together to support the support network that we have built. There are some programs that National runs as telephone visiting, internet visiting, website visiting, and things like that. But our local chapters are really the strong boots on the ground, so to speak. They're the ones out there reaching the patients face to face. They have developed individualized programs for their community to help them meet the needs of their individual community, because maybe the patients in California won't have the exact same needs as somebody in Pittsburgh. And at National, we work with them to provide them with the supports that they need to be able to do their community efforts in person.
Fantastic. That's very clear, and I think so logical because, as you said, the how people connect in different communities varies, and what they need in different communities vary. We did put up on the slide that Andrea had other ways to get involved and reach out to Mended Hearts. Right now, the slide you're looking at simply has their website and Andrea's email. But another great question coming in, Andrea, is let's say you have a loved one, a wife, a husband that has heart disease. Where would you suggest that first step in finding social support should be? Of course, there's maybe a lot of different ways to get started, but if you're kind of overwhelmed or don't know where to begin, how would you recommend beginning to find social support? And that's a great question. Thank you to our audience member for asking that.
I agree. Such a great question. I can remember when my son was diagnosed and my doctor was telling me, the first thing I could think of was, I don't even know how to spell that. How am I going to Google it? And that was the really big problem that I had, where to turn and what to do. And the information that I found was so overwhelming. I think that the first thing I would always suggest is to visit mendedhearts.org. We have so many different tools and resources, from where to find your local chapter. If you look up, we have a map that will say, connect with us. We can show you on the map where our chapters are if there's a local one in your area and you're interested in that connection one-on-one or in person. We have online support as well within our communities. But we also have information, and that information can be kind of absorbed little by little, so to say. With our heart guide, it's broken down into different topics, and you can read just what is important to you at this point in your journey, or you can read it all and refer back to it as you need. So definitely the first step is to go to the website or call the 188 number. It's 188-HEART-99. And we can always connect you to the exact type of support that you're looking for.
That's fantastic, Andrea. And much like Mended Hearts, NeedyMeds, we always refer people to our website, but sometimes people don't have the luxury of having a computer or internet access at home, or they may simply be comfortable speaking one-on-one with someone. So I think having the ability to just pick up the phone and talk to another human being is really crucial. A couple of other questions, Andrea. Can you help people with things like getting the insurance company to approve medications?
So this is a great, I think, example of how a support network can actually make a big difference. We recently actually had a group of peers who got together because one person was not able to get access to their medication. They kind of took to social media and made a ruckus, so to speak, to get the attention of the insurance company, to get the attention of the pharmaceutical company who made the medication, who then got in touch with the insurance company and the doctor. And it kind of all was spearheaded by the fact that a few people worked together within their social network to say, we're not going to stand for this and we're going to work together and get this done. Now, obviously, that doesn't happen in every case, but I think it's really great that you can have friends in the trenches with you to say, we're going to get this done and let's find a way to do it.
So true. So true. And actually, I have a couple of questions coming in, all sort of asked in a different way from different areas of the country, but all asking really the same question, which is somebody may live in a rural or more isolated area, or other questions that are really asking the same thing is, how do I find people in my area to get support from?
And that's really a great question too. I think that not only can Mended Hearts or NeedyMeds or any of our larger organizations be a great support system, I also think that, when you go to your cardiologist's office, it can't hurt to say, is there a support network meeting? And if there's not, could we work with you to connect other people at the same time for coffee? Take those first steps and say, I really would like to meet people in my area, and maybe the hospital is 30 miles from you, or in the cardiac rehab center, or in the local area that you get your, the cardiologists are. Ask them if they can connect you with other patients. They can maybe put a flyer up and have a coffee. Cardiologist offices are usually very open to connecting, to making you have the ability to connect with other patients, even though they can't do that themselves.
Very helpful. And a lot of people listening are either in the position of going to their doctor or specialist on a regular basis or accompanying a loved one. So I think the advice is really practical and something we can all keep in mind when we visit our doctors or accompany our loved ones to those appointments, which is it's not going to hurt to simply ask if there is a support group or social network, and look around that office for pamphlets or flyers. If you don't see them, as Andrea said, please ask. I do see a couple of questions coming in about NeedyMeds. Of course, I love the opportunity to plug NeedyMeds, so I'll get to that in just a moment. But one other question for you, Andrea. You had mentioned earlier in the webinar that Mended Hearts did a survey on the benefits of finding social support. What would you say some of the risks of not finding a social support network are?
So I think that along with cardiac issues, I think that anytime that you have a medical complex crisis, so to speak, the risk of depression is there, the risk of isolation, feeling vulnerable, and really feeling out of control. One of the things that I experienced was, I felt so out of control as my son's caregiver and as a mom that the only thing I could do was, work on keeping the calories in him, basically, because I had no more control over my life. And so I think that when you empower people with that information of you're not alone, that you start finding a way to not be depressed. You start seeing a light at the end of the tunnel, and your emotional well-being is so much better off before you had that support.
It is true, and it drives home the point you had made earlier, Andrea, which is that really connecting with other people provides a sense of empowerment. And the one crucial thing that you heard so early in your journey and your son's journey was just hearing you are not alone can just sometimes offer that level of empowerment to take your health back, regain control of your health, or at least begin the first steps into doing that. As I had mentioned, we do have a couple of questions coming in about NeedyMeds, which I'm really happy to see. One of the things I will say we pride ourselves on at NeedyMeds is the robust information that is available on our website. I will say very candidly, it can be overwhelming. And as I had mentioned, if you're looking for support, you can check out the patient savings tab of our website. But please don't hesitate to call our expert call center expert counselors at our call center, which is 1-800-503-6897. I have somebody asking specifically whether or not NeedyMeds offers low-cost clinics for dental care. We do. One of our most popular destinations is our free, low-cost sliding scale clinics, again, under the Patient Savings tab. We have more than 15,000 clinics in that database, and it's broken down into not only medical and dental clinics, and you can search either for something, you can type in your home address and search for something within a radius of your home address, or you can search a little broader by zip code, or even broader still by state. And again, these clinics are broken down into not only medical and dental clinics, but they're also broken down into mental health clinics and substance addiction clinics. So I would say if you're looking for free, low cost, or sliding scale dental care, certainly check out that clinics database on the NeedyMeds website. And once you pull up that search, it will hopefully provide you with all the information you're looking for, meaning it won't only show you the name of the clinic. It'll have the name, contact information, including website and phone number. It'll also tell you what services they provide, what hours they're open, and of course, what fee can you expect? Because that's really crucial. Um, I actually have somebody else asking me about the history of NeedyMeds. And I won't get into too much of that, with the exception of making one connection between NeedyMeds and Mended Hearts. As Andrea had said, Mended Hearts was founded by a physician back in 1951 who really, through the course of his work, saw the benefit of social networking. Similarly, NeedyMeds was founded by a family physician 20 years ago, Dr. Richard Sagel. He's still our president. And while Rich was treating his patients, he found many of them were not taking their medications. And in just being the type of person he is, instead of just saying, oh, well, and turning the other way, he started inquiring as to why. And the unfortunate reason, and many of us have been there ourselves, is simply that people couldn't afford them. So he started looking into ways to help people afford their medication. The website started out 20 years ago with only a couple of dozen prescription assistance programs, and it has grown into a website that offers more than 20,000 points of cost savings. So I wanted to share that because I thought it was a wonderful similarity between Mended Hearts and NeedyMeds. And the truth is, once you start engaging with organizations such as NeedyMeds and Mended Hearts, you will find other stories, other organizations, other support networks, and other advocacy programs where people were either themselves on hard times or watch others suffering through hard times and knew they can step up and make a difference. So thanks for asking about that. We do have a bunch of other questions coming in, but it looks like we are running out of time. I do want to take a moment to also remind everybody that NeedyMeds works really hard to populate our calendar with free webinars, including a whole host of different topics. So I do hope you join us for future webinars. And again, you can register. On the bottom right hand of the NeedyMeds page is an events calendar, and you can find all of our upcoming webinars there. I'm going to go ahead and leave everybody with the slide for the contact information. Thank you to Andrea for taking time out of her day to share her expertise, and thanks for our audience for being so engaging and certainly patient as we worked our way through our technical difficulties. Thank you so much, everyone, and here's hoping you have a happy and healthy rest of the week. Take care.